Hi, I am Dr. Sateesh Rao, AK, consultant gastroenterologist and hepatologist. I am practicing as a consultant in Narayana Multispeciality Hospital, Mysore, Karnataka. Hepatitis is inflammation of the liver. It is caused by viral hepatitis like hepatitis A, hepatitis B, C, D, and E. In this, hepatitis A and B causes acute infection of the liver, and B and C usually causes acute infection, also chronic infections resulting in cirrhosis of liver, sometimes cancer of the liver and death. So, hepatitis is one of the very important health concern all over the world and especially in India, where hepatitis A and hepatitis E are epidemic in our country. Hepatitis A and E are foodborne infections. That means it occurs or enters in the body by the contaminated water or food, causes acute infection of the liver resulting in the symptoms jaundice. Hepatitis B and C are blood-borne infections. That means comes to the body by the blood or blood products. Hepatitis B usually comes from the unscreened blood from mother to baby, unprotected sex, and also by the use of a contaminated razors or scissors, and also from sometimes by the hemodialysis. Hepatitis C usually comes from the blood or blood products only. Coming to what are the symptoms of hepatitis? In case of acute hepatitis, symptoms, that is the problems to the patients, that is predominantly in these forms: myalgia, tiredness, weakness, loss of appetite, nausea, vomiting, and jaundice. In case of a chronic hepatitis caused by hepatitis B or C, symptoms will be like this only, but it will be a prolonged symptoms. Sometimes the symptoms may persist for a months before coming to the doctor. How to diagnose this hepatitis? If you have some symptoms like what I have told or any undiagnosed jaundice, you have to meet the gastroenterologist or hepatologist. Usually the gastroenterologist will advise following investigations for a test like a liver function test, ultrasound abdomen, and he will order for the antibodies to the viruses like hepatitis A, hepatitis E, HBsAg, and also the antibodies for the hepatitis C. Depending on the results of this test, he will order some other test to confirm patient requires a drugs or not. So this is how the doctor will diagnose about the hepatitis. How to cure this or how to treat this hepatitis? As I already told, hepatitis A and E is a self-limiting disease. That means most of the young patients, it is spontaneously resolves over 8 to 12 weeks of period. In case of hepatitis B, acute infections sometimes resolves spontaneously. In case of a chronic hepatitis B, drugs are required, but no drug will completely cure the disease. Usually it will reduces the progression of the disease by halting the viruses. Commonly used drugs nowadays are lamivudine, entecavir, tenofovir, and along with that sometimes pegylated interferon will be used in some selected cases. Coming to hepatitis C, here it will be caused by 4 different genotypes of the hepatitis C viruses. One thing about hepatitis C is if you receive treatment, it will be completely cured. Treatment for hepatitis C is in the form of pegylated interferon, that is one of the injections, along with a ribavirin tablet. This is the commonly used treatment for the hepatitis C. Duration of the treatment depending on the type of viruses, it may be 24 weeks or it may be 1 year, that is 48 weeks. How to prevent this hepatitis? Hepatitis A and E are foodborne infections. So hygiene is very important. By taking the hygienic food or doing a good hygienic practice, we can prevent the epidemics of the hepatitis A and E. Coming to hepatitis B, the one thing is vaccination. Vaccination of the children, vaccination of the hemodialysis patients, vaccination of the health workers, and also taking the universal health precautions during the procedures or in healthcare workers. Other than this, safe sex and avoiding the unscreened blood and blood products, from these measures we can prevent the hepatitis B. For hepatitis C, at present there is no vaccine is available. The only thing is we should make sure that the blood or blood products what we are receiving is screened and good one.